Welcome to the Bernade channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for impaired swallowing. Nursing diagnosis. Impaired swallowing. Related to neuromuscular impairment, structural defects, or cognitive decline as evidenced by coughing or choking during meals, food refusal, or prolonged chewing time. Nursing diagnosis. Impaired swallowing. Part 2. Additional evidence includes changes in voice quality after swallowing, drooling, nasal regurgitation, unexplained weight loss, or recurrent respiratory infections. Desired outcomes. One patient will demonstrate safe swallowing techniques without signs of aspiration within 7 days. 2 patient will maintain adequate nutritional status, with no weight loss exceeding 5% of body weight in 1 month. Desired outcomes. Part 2. 3 patient and caregivers will verbalize understanding of aspiration precautions and demonstrate proper feeding techniques within 24 hours of education. 4 patient will report increased comfort and confidence during meals within 5 days. Assessment. 1. Conduct comprehensive swallowing assessment using standardized tools, example bedside swallow evaluation. 2. Observe for signs of aspiration during meals, coughing, choking, wet-sounding voice, or respiratory distress. Assessment. Part 2. 3. Assess nutritional status, weight, BMI, recent weight changes, albumin levels. 4. Evaluate oral hygiene and dentition. 5. Assess cognitive status and ability to follow swallowing instructions. 6. Monitor for signs of dehydration or malnutrition. Nursing interventions. Swallowing management. 1. Collaborate with speech therapist to determine appropriate diet consistency and safe swallowing techniques. 2. Implement prescribed swallowing exercises and maneuvers, example chin tuck, supraglottic swallow. Nursing interventions. Swallowing management. Part 2. 3. Use thickening agents for liquids as prescribed. 4. Ensure proper positioning during meals, upright at 90 degrees or as recommended by speech therapist. 5. Implement small, frequent meals if tolerated better than large meals. Nursing interventions. Aspiration prevention. 1. Elevate head of bed 30 to 45 degrees during meals and for 30 to 60 minutes after. 2. Provide oral care before and after meals to reduce risk of aspiration pneumonia. 3. Avoid use of straws unless specifically recommended by speech therapist. Nursing interventions. Aspiration prevention. Part 2. 4. Ensure patient is alert and cognitively able to participate in feeding before offering food or drink. 5. Implement suctioning protocol if ordered, especially for patients with tracheostomy. Nursing interventions. Nutritional support. 1. Monitor daily caloric intake and adjust as needed to meet nutritional goals. 2. Collaborate with dietitian to ensure diet meets nutritional needs while maintaining safe consistency. 3. Consider alternative feeding methods, example nasogastric tube, PEG tube, if oral intake remains inadequate. Nursing interventions. Patient and caregiver. Education. 1. Teach patient and caregivers signs of aspiration and when to seek immediate help. 2. Demonstrate proper feeding techniques, including pacing and appropriate food consistencies. 3. 3. Educate on importance of proper oral hygiene to prevent aspiration pneumonia. Nursing interventions. Patient and caregiver. Education Part 2. 4. Instruct on proper positioning during and after meals. 5. Provide information on dietary modifications and use of adaptive feeding equipment if prescribed. 6. Teach strategies to increase appetite and make meal times more enjoyable. Evaluation. 1. Patient demonstrates safe swallowing techniques without signs of aspiration. 2. Patient maintains stable weight within 5% of baseline or shows appropriate weight gain. Evaluation. Part 2. 3. Patient and caregivers verbalize understanding of aspiration precautions and demonstrate proper feeding techniques. 4. Patient reports increased comfort and confidence during meals. 5. No new episodes of aspiration pneumonia or respiratory distress related to swallowing occur. Important notice. This presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for answers to more than 3,000 questions.